Hello, Dr. Jake Reinkraut, podiatrist from Complete Foot and Ankle in Bergen County with offices in Ridgewood, Garfield, and Newark. Happy to answer any of your questions. We've been getting a couple online and happy to tell you how to treat some of these things and how to diagnose them, and happy to answer more of them. So one of the questions has to do with numbness in the feet. You know, what causes it? What do you do for it? One of the most common causes of numbness in the feet is diabetes. Sometimes you can even have this when you're a pre-diabetic, before your even blood sugar is abnormal or you're even diagnosed with diabetes. If you have a family history of diabetes, or you've been told that you're pre-diabetic and you start having some numbness, tingling in your feet, unfortunately it's usually diabetic neuropathy. This usually acts up at night when you're doing nothing. You know, pain when you're doing nothing, when you're just sitting in a chair or in bed, is abnormal. That's not orthopedic. That's not a bursitis, a fracture, a trauma. That means your nerves are acting up abnormally. That can be from spinal stenosis or degenerative back disease. That can also cause some radiculopathy or pain that radiates down your leg. But diabetic neuropathy is the most common. What's important to know about that is you can hurt yourself and not know it, because neuropathy is the worst of both worlds. You have pain and numbness when you shouldn't. You're just sitting there in bed. You haven't hurt yourself. Why does it hurt? Why do you have that numbness? And when you do hurt yourself, if you step on something, step on a piece of glass, or walk so much that you have a little bruise or wound on the bottom of your foot, you don't feel it. So unfortunately, it's the worst of both worlds, and it gets people into trouble. So happy to help anyone with any of those issues. There are some medications. Usually first line is best blood sugar control, exercise, supportive shoes, and then there are some medications if it really starts affecting your life, meaning stopping you from doing things you're doing or waking you up at night. That's a couple of causes of neuropathy. Happy to evaluate you if you do have any of these neuropathies, and check your feet regularly. Feel free to ask any more questions. Have a great day.